Hello everyone, I'm Ruba Bayram, currently a second year medical student, and today I'll be talking about the coronary circulation or the blood supply of the heart. To start off, the coronary circulation it's basically a blood that is going to be moving from the heart and to the heart instead of to the body. So from the heart to the heart, when we're going to be carrying oxygenated blood, it is going to be through the arteries. Let me draw it with a red color actually, so you know it's oxygenated blood. And if I'm going to be carrying deoxygenated blood from the heart to the heart, it is going to be through the veins. Okay, so and let's start with the arteries. As we mentioned, the arteries are carrying oxygenated blood from the heart to the heart. So the coronary circulation, the idea is just through the hearts, the blood. So let's draw the heart. This is the heart. We have the superior vena cava. It is very simplified drawing. The inferior vena cava. Here's my right atrium, left auricle, whatever. So I have my just simply reminding us how the circulation goes. This is my pulmonary orifice. This is my right ventricle, which is going to be pumping the oxygenated blood to the lungs to get oxygenated. And then we have my aortic orifice or valve, where the left ventricle will be pumping what? Oxygenated blood through the aorta. So why I showed this is I wanted to show you that the coronary arteries or circulation, the coronary arteries are going to be carrying oxygenated blood, and therefore they're going to be originating from my aorta, which carries this oxygenated blood. Okay, so this is my pulmonary and this is my aortic orifice. The aortic valve is a semilunar valve. It is a tricuspid valve. It has tricuspid sinuses, 3 sinuses. The aorta, we learn it as, since it's starting with an A, it has 1 anterior sinus and 2 posterior sinuses. So this is my anterior, 1 anterior and 2 posterior. So this is my aortic valve. And the coronary arteries, we have a right coronary artery and a left coronary artery. They are carrying oxygenated blood, and therefore they're originating from my aortic valve. The right coronary artery is going to be originating from the anterior aortic sinus. So this is my anterior aortic sinus, and this is the origination of my right coronary artery, and then it continues. The course of the right coronary artery is between the root of my pulmonary trunk and then the right atrium or right auricle, and continues all the way like this. As for my left coronary artery, it is going to be originating from the posterior sinus. The posterior aortic sinus, we have 2. We have a right and a left. Since this is the left coronary artery, it is going to be originating from the left left posterior aortic sinus. Okay, so now we understood the origination. Let's go back to the right coronary artery. Let's focus with that. The right coronary artery origination was the anterior aortic sinus. The course is going to be between the root of my pulmonary trunk as well as the right auricle or atrium, and it goes all the way like this. The branches, we have a right marginal artery, and from the name it is at the margin of the heart. And then the right coronary artery will follow and goes from behind, so that's why it's a dotted line. It loops behind and gives us another branch behind in the posterior interventricular groove, known as the, from the name, it's a posterior interventricular artery or my posterior descending artery. Okay, so the right coronary artery gives us 2 main branches, the right marginal artery and a posterior descending artery that is found in the posterior interventricular groove from behind. Right coronary artery also gives us other branches, such as atrial branches, such as ventricular branches, such as septal branches as well. We also have blood supply to our nodes. We have the SA node, which is also going to be found in the right atrium. If we remember location in the right atrium, just below the opening of my superior vena cava. So we have a branch also for that. From the right coronary artery, a branch for the SA node, and also a branch for my AV node as well. Moreover, we have a right conus artery. The right conus artery is going to be originating from my right coronary artery. Now let's go to the left coronary artery. The left coronary artery, the origination was my left posterior aortic sinus, and unlike the right coronary artery, the left coronary artery, it has a very short stem or very short trunk, because right away it will give us the branch. The main branches are my left anterior descending artery, which is found in the anterior interventricular groove. So that's why another name for my left anterior descending artery is my anterior interventricular artery, because it's found in the anterior interventricular groove, the same way as we have the posterior descending. The left coronary artery will also continue as another branch known as the left circumflex. So the left coronary artery gives us these main two branches, the left anterior descending, and continues as my left circumflex artery. From the left circumflex artery, since it's the continuation of my left coronary artery, we have a lot of branches coming from the left circumflex. We have the left marginal artery, just like we have right marginal, we have a left marginal, but the difference is that the right marginal had originated from the right coronary artery, and the left marginal, no, it didn't originate from the left coronary, it originated from the left circumflex. The left circumflex will then loop from behind and go from behind the heart, and it will actually start to anastomose with my right coronary artery that was from behind. So here we have an anastomosis, this pink circle. Actually, we have two anastomoses here. The first anastomosis is between the left circumflex and my right coronary artery from behind, and the other anastomosis is between the two interventricular arteries, the posterior descending and my left anterior descending. We have anastomosis from behind as well. This is the pink circle, which shows the anastomosis. Okay. Just like we had the atrial branches, ventricular branches, septal branches, we also have these branches for the left side of the heart. Except, since I mentioned the left coronary artery, it has a very short stem, and it right away branches into the left coronary artery, left circumflex and left anterior descending. We see that the branches are going to be originating from where? From my correct left circumflex, right? So from the left circumflex, I'm going to be having atrial branches, I will have ventricular branches, I will have septal branches as well. So all these branches are going to be coming from the left circumflex, not from the left coronary artery. Okay. Now, just like we had the right conus artery, we have a left conus artery, and again, it won't be coming from the left coronary artery, since the left coronary artery is very short and doesn't have these branches. The only two branches it gave off was these. The left conus artery will be originating from, this branch is going to be originating from, no, it's not the left circumflex, it is the left anterior descending. So you might have thought it's the left circumflex, since all the branches, like the atrial, the ventricular, the septal, the left marginal, all of these branches are coming from the left circumflex. You're correct. But the left conus artery, it is going to be coming from the left anterior descending artery this time. So this is very important to note, that the left conus artery is originating from the left anterior descending, but the right conus artery is going to be originating from the right coronary artery. The right coronary artery is very easy to learn, because all the branches are going to be coming from the right coronary artery. Now, we mentioned also that we had blood supply to this A node and AV node. The left circumflex artery, yes, my left circumflex artery, since most of our branches are from there, also gives us SA node and AV node branches, or supply to those. However, most of the population, around 60% of the population, their blood supply of SA node is going to be coming from the right coronary artery, and for the AV node, it's around 80% of the population. Their blood supply of the AV node will be coming from right coronary artery. The rest, it will come from the left circumflex artery. Last thing I want to discuss is my interventricular septum. The interventricular septum also is going to be having supply. It's very easy to understand. We have 1/3 of my posterior interventricular septum and 2/3 anteriorly. Posteriorly, what is found in the posterior interventricular groove? The posterior descending artery. And the posterior descending artery is going to be originating from where? From the right coronary artery. So that's why this is going to be supplied by the right coronary artery. And as for my anterior interventricular septum, we have the anterior interventricular groove, which lies in it the left anterior descending. The left anterior descending is going to be coming from it's a branch from the left coronary artery. That's why this is the distribution of the blood supply. That's very easy to understand, hopefully. Now we will go to the veins. As we mentioned, the veins are going to be carrying deoxygenated blood. So let me draw the heart once again. This is my superior vena cava, inferior vena cava, right atrium here, and okay. So the veins are going to be carrying deoxygenated blood. If we remember, the deoxygenated blood, it came into the heart through the right atrium. So deoxygenated blood from the superior vena cava, from the inferior vena cava, all of them drained through openings into the right atrium. But we also have another opening, if we remember, in the right atrium, known as the coronary sinus opening. Yes, the veins, most of my veins are going to be draining into my coronary sinus. The coronary sinus let's say this is my coronary sinus. It is actually going to be drawing the limit of my base of the heart. What is the base of the heart? The base of the heart is my left atrium, and as we know, the base of the heart is from the posterior side. So this, I'm looking posteriorly now. So this is my left atrium, this is my left ventricle. Here we have obviously the right atrium, and as we mentioned that the coronary sinus will be draining into my right atrium. That's why we have the opening here, right? So the coronary sinus is going to be the inferior limit of my base of the heart, and then it goes and drains into the right atrium right here. So my veins will start to drain into the coronary sinus, so that they drain into my right atrium. What are these veins? We have 5 veins that are going to be draining directly into my coronary sinus. We have 3 cardiac veins which are easy to learn: great cardiac vein, middle cardiac vein, and small cardiac vein. Let me draw the coronary sinus actually here as dotted line, because as we mentioned, it's posterior from behind. This is my, the base, صح? So let's draw it as that, it's dotted line. Let's draw the veins as in blue color here. The great cardiac vein, which is nice about this, is that they're going to be following along with the arteries. For example, the great cardiac vein is going to be following the same location or same pathway as the artery, which is the left anterior descending. The left anterior descending was found where? In the anterior interventricular groove. So we'll see that the great cardiac vein is also going to be just the same, but it will loop from behind and drain where? Into my coronary sinus, like we mentioned. So here you can see that it's going posteriorly, dotted line, and then it's going to be meeting with the coronary sinus, which is the pink one. Remember, this pink is my coronary sinus, and it drains right into it. So this is my great cardiac vein. It will be the same pathway as my left anterior descending, because it's found in the left anterior interventricular groove. As from the middle, it is found alongside the posterior descending artery or the posterior interventricular groove. So it is going to be from behind. This is my middle cardiac vein, and it drains directly into my coronary sinus. The small cardiac vein is going to be running along the right marginal artery. If you remember, this is the right marginal artery, it was here. So the small cardiac vein is going to be running along with it, and then it goes from behind so that it drains into my coronary sinus. So this is my small cardiac vein. Now this is only 3, and we mentioned that there's 5 veins that are draining into the coronary sinus. So I am left with 2. 2 of those veins are going to be one for the atrium and one for the ventricle. We're talking about the left side. So I have an oblique vein of my left atrium, and it's also going to be draining from behind or to the coronary sinus. And we have the posterior vein of my left ventricle, and it's also going to be draining into my coronary sinus. So now I mentioned that we have 5, right? I have 5 veins draining to the coronary sinus, and we can count them. We have 1, 2, 3, 4, and 5. The oblique vein of my left atria, what is this? Coming in the anterior interventricular groove. The great cardiac vein, this is my posterior vein of my left ventricle. Here it is found in the posterior interventricular groove. The middle cardiac vein, and this right here, this one is my small cardiac vein. Actually, we have also some veins that instead of draining into the right atrium through coronary sinus, they will drain into the right atrium directly. These, we have 2 of them. We have an anterior cardiac vein, and we have the veins of the caudus minimi. Okay, the anterior cardiac vein are going to be around 3 to 4 veins, and they are going to be, as we mentioned, draining directly into the right atrium. They won't drain into the coronary sinus. They are around 3 to 4 veins, small veins, and they're in this location, and they drain right into the right atrium. So this is my anterior cardiac veins. As for my veins, caudus minimus veins, they are going to be all around the heart, and then very, very small veins, and they will drain directly inside the heart. Okay, so this is the coronary circulation that includes the arteries as well as the veins. Hopefully with this diagram we made it easy to understand, and thank you.